Rolling.
It is on?
Yes, it's filming. So I'm today with Dr. Pradeep himself. Believe it or not, I managed to catch him in London. I don't know how I managed to do it, and actually he planned his trip in one day. So, hey, great coincidences. And you know what I was thinking? To get his brain on my, my head of hair. To see how, what he thinks, how much I can progress in the future, how my donor area is, what's possible. Yeah, what do you think?
So first of all, Rolandas, the name says that, Indian name, and that gives me a lot of familiarity with him, and it looks like as if I know him. Even though this is my first meeting with him, he has got warmth, he has got genuinity, he has got a sincerity that, really that has pulled me towards him. Initially we had a little bit of chatting, but now after seeing him, that really I feel like, as if I know him, and he's such a nice boy. And he wants to help a lot of prospective patients who otherwise, because of lack of research, they would end up in bad clinics. And this boy, he has done his own research, and he has got an amazing hair transplantation done by a very good doctor. And it doesn't look like he has got a transplantation done. And his donor is kind of impeccable. He has got, already, how many grafts have been taken, Roland?
6,500.
6,000 has been taken. I have seen this. And it is smartly what he has done. He has kept the hair a little bit longer, so that all the scars and everything kind of hidden. So that is one trick one is to play. If you are going for excess, not excess, I would say, if you want to go for more than 3,000 odd grafts from your back, then you cannot imagine that you will be keeping it short, or if you are going to like clip it or make it number 1, number 2.
Yeah.
You have to keep at least this length, so that all those the extraction points are hidden. Whether you have got a blonde skin, whether you have got a dark skin, it doesn't matter. Technically there will be a scar. When you prick the skin, there it will leave behind a scar. And if you have got a punch size more than 8 millimeter, that could be 0.8 millimeter rather, then that could be a little bit bigger. But it does not matter whether 0.8 millimeter or 0.9 or 1 millimeter. According to the size of the graft, you have to use the size of the punch.
I had between 0.8 and 0.85 millimeters, size of the punches.
Yeah, again, as I said, depends on the size of our grafts. You cannot use a smaller punch, otherwise the grafts will be divided and cut and injected. But the trick here, what smartly Rolandas is doing is keeping a little bit of length of hair on the back, so that all the extraction site has been kind of covered. So he had put a question to me that, doctor, how many more grafts that you can potentially extract from my back? My skill set and experiences, we can pull out close to 3,000, maybe 3,500 more grafts from whole area, from the front and kind of in the back and all, without making it look bad. That means, like, if he continues to keep this kind of length, I can still pull out more than 3,000 grafts from the back, that's for sure. And he himself, he knows that the frontal part is the kind of that area that he got it done. The mid part and the crown, they were not 100% bald at that point of time. So now the crown is kind of thinning, and he can show the pictures later on in his video. He can edit that. The crown is thinning. The merging area between the transplanted and non-transplanted, there is some kind of area that started showing up. And he's very, very smart and intelligent boy. He's taking oral finasteride. He's also taking oral minoxidil. All those things are helping him to kind of slow down the speed of baldness. Maybe they have stopped the baldness. Even if they have not stopped, even if they have slowed, then that is also an achievement. And he's doing all those things correct, and his density and everything is perfect. He has got a little bit of temple on both the sides. They're looking all very, very, very natural. I should give I should congratulate him for a very great job. And it has all come with a lot of research.
Yes.
He has done a lot of research, and he was saying that he was contemplating between coming to us or coming to the doctor he went to. So he has done his due diligence, and I should, I'm sure he will not regret the many years of research that he has put into his decision. And that's what, you should not jump to a transplant. You should take a lot of time, maybe potentially 1 year, 1.5 years to do this kind of research. It takes that much of time, and you will not regret the time that you have spent on that research.
100%.
And maybe after 5-6 months, he might do a little bit of touch up if he wants to. Maybe like 500-600 odd kind of hair in the both left, right, and the crown, and that he might not get. Also, he can put topic and fibers, he can get away. But if he really wants to have hair and put less amount of topic, then I would say around 500-600 grafts both here on both the sides and the corridors on both the sides and the crown. That's it. I would.
So
yeah.
would it be 1,200 grafts
No,
altogether?
altogether 600-700.
600-700
Yeah,
everywhere, including crown.
around 300 here, 200 here, 200 here, something like that.
So it's very small, tiny,
Yes.
minor procedure just to kind of finish it off.
Yeah.
What do you think of my future baldness? How does it look like? Does it look like I'm progressing towards Norwood 6, Norwood 7 maybe even? What do you think?
It looks like you will go up to Norwood 6. Norwood 7, like at 30, because the humps are quite protected, they does not look like receding kind of thing. I would think it is going to be Norwood 6, not Norwood 7.
Yeah, that's what I was thinking as well. It looks like the crown has a little bit miniaturization. When the hair is shorter, you can kind of see a little bit the outline, but there is still lots of hair. So finasteride obviously minoxidil is helping me tremendously, and I'm hoping it's gonna stay this way. So yeah, that's great. So you think 3,500? This is
No, like I'm pretty sure what I'm talking about. And if you are
That's
like
good.
determined to keep this length, then yes, it is.
yeah, I'm happy. I mean,
But if you
I don't mind.
If you clip it, a lot of people do that, and they say, "Oh, doctor, like it looks like over extraction." Then from where you will get the grafts? Like if you have to take hair from some area and put to somewhere else. We cannot create hair out of air, and you cannot kind of. It is a renewable resource.
Yeah.
So, but it has to be done very, very smartly.
Yeah. What would you think? Would you like personally, in my case, to lower the hairline, to bring the temple peaks further, to fill them in somehow, or would you leave it like it is? What do you
No,
think?
definitely hairline I would not lower. Already it is, to me, it is appropriate. If I would have done in the first go, I would have kept it here, or maybe not few centimeters, I would say maybe like half centimeter up.
Oh.
This is anyway appropriate. Coming to temples, always temple is a kind of is a war. A lot of people they don't enter into that war, but the temple is looking okay. It is not looking bad, and still there is little bit of scope of improvement according to me. I will put little bit more fine, thin baby hair to make it look more softer and merge in the things. And the frontotemporal angle, as I highlighted you earlier, some of the hair they're like going little bit randomly. Even I improve on every case. Even I struggle when how to merge that frontal and temporal that in temporal hair. So
Yeah, this area is a bit tricky.
since like I'm highlighting, I'm not commenting on anybody's work. It is really nice, but given chance, I would also work on these things. Even my patients who come at your stage, I feel like, oh my god, I can do a little bit touch up to make it a little bit more better.
It's always there's always room for improvement. As Eyes can always find something when you OCD like we are. Well, anyways, thanks so much, Dr. Pradeep. Pleasure to meet you once again. I couldn't believe that you're here and I was able to catch you like that. It's just mind blowing, and I really wanted to get your opinion. Focus on the good side too, so people could potentially avoid the bad ones, so they don't need to come and fix it later, because we all know if once you need to fix something, it's already catching up. Really, it's not gonna be.
It is very difficult. I cry from my heart when I say a kind of bad hair transplant which needs to be fixed. It is very difficult because you have to extract those grafts, put it back. It will be never look that natural the way in the first go I would have done.
It would have been, yes.
So I feel very sorry and very sad when I see all those kind of things, and we end up doing almost like one or two corrective procedures every day between me and Dr. Arika, Dr. Pedasri and Dr. Somesh. At Eugenics, we end up doing almost one corrective procedure every day, and feel so bad, so sorry that people jumped for a procedure because of the local proximity or geographic kind of thing advantage, or they went for cheap price and very less time of the other guy that you met. The other guy, he said like within 24 hours I decided to go for a transplant, and he got it done, and now he's putting all his life's energy, time to research and to find the right doctor, and he's churning the whole world, which clinic, which doctor kind of thing. Now he has become skeptical. He's now he's afraid.
It's really bad.
So do the
research as much as possible. That's what we do here on this channel. Thanks so much, guys, for watching, and I'll see you in the next one. Peace out.
Thank you.
Cool. That was great.